Hello, hello. Today I wanted to answer some frequently asked questions about Mounjaro. So, what is the best time of day to take Mounjaro? The best time of day to take Mounjaro is not really specified by the manufacturer, which is Eli Lilly. They say the medication should be taken once a week, any time of the day that's most convenient for you, which is great because they don't tell you when you have to take it. But when you're taking the injections, you kind of have to be strategic about it. I usually take my injection at night, and I wish it was more convenient for me to take it in the morning because I would remember it better. It's not. It's easier. It just makes me function better in the day if I take mine at night and go to bed because I try to avoid the side effects. But it says if you opt to take it in the morning, it's much easier because you get into the routine of waking up, and most people have a routine of waking up, and they have to do A, B, C, and D to start their day. And making the injection could be on your list of things to do. It says opting for morning administration may assist in creating a steady daily schedule, which alleviates skipping your doses. If a dose is missed, this is important. If you do miss a dose, it should be taken as soon as possible within 4 days. And if more than 4 days have passed, the patient should skip the missed dose and take the next dose on the regularly scheduled day. So if you miss, if you notice 4 days have gone by, just skip that dose for the week and start when your normal day is. Anytime before that, you can take the injection. Another question I have seen is if you notice air bubbles in your pen, is that normal? And according to Eli Lilly, it's perfectly normal to see air bubbles in your pen. So just in case you saw those, you were wondering why you have those, it's pretty normal. Nothing's wrong with your pen. Is your pen not at room temperature? Is it okay to take it? According to Eli Lilly, there's no need to warm the pen to room temperature before you use it. And even though they say you should not do that, I always do. I always take my pen out. I let it sit out room temperature for at least 30 minutes. I do that because I noticed that when it was cooler, the temperature of the pen was cooler, it made a little burn, or I felt a sensation that I don't feel when it's room temperature. So that's just preference. That's not anything that's research-based or other people have necessarily said, but that's my personal experience. It's just better for me when it's room temperature. And I haven't had an issue anytime it was. The next question is, if you accidentally unlocked your pen and you pressed the purple button before removing the cap, what should you do? Well, according to Eli Lilly, it says, in this case, do not attempt to use the pen. Discard it and use a new one. I am so glad to say that has never happened to me. Let me knock on wood, as of now, that has never happened, and I'm hoping that never happens. So if that happens to you, do not use the pen, use another pen. Next question, if you found a drop of liquid at the needle's tip after the cap is removed, what should you do? If you see a drop of liquid on the needle tip, that is expected, but it does say avoid touching the needle. And I do that at all costs, just for sanitary reasons. I never touch the needle. Should you keep the injection button pressed down throughout the time you're taking your injection? And according to Eli Lilly, it's not required. Holding the button down may assist in maintaining the pen's position on your skin. And I do agree with that. Should you keep the injection button pressed down throughout the whole entire time? I do keep it pressed down until I hear those clicks, but I guess you don't have to do that. Let me read that again. It says, should you keep the injection button pressed down throughout? While it is not required, holding the button down may assist in maintaining the pen's position on your skin. So I think that's a good strategy. You don't want it to move around and have some wiggle room. The next question, somebody asked, what if you heard more than 2 clicks during your injection? I have never heard more than 2 clicks. I hear the first click, I wait for 10 seconds, and I hear the second click. And that lets me know that everything is great. According to Eli Lilly, hearing a soft click before the second louder click is part of the pen's normal function. Wait for the second loud click before removing the pen from your skin. I actually count 10 seconds after I hear both clicks just to make sure that everything went according to plan. So I wait, push down, I hear that first click, I hear that second click, I count to 10 seconds, and then it's over. The next question is uncertain if the pen functioned correctly. I've heard people talk about that, and because it's so seamless, the injection, I have had to think about that too. Did this actually work? Did the medicine actually go in? So it says if you're uncertain if your pen functioned correctly, I'm going to read the actual answer from Eli Lilly. If uncertain about the pen functionality, then refer to the Eli Lilly literature. Maybe call the number that Eli Lilly provides just to make sure that you actually took your injection correctly. But they do suggest that you keep your pen stored securely to prevent accidental needle stick. You always should dispose of that immediately. You don't leave it sitting around. That's just for safety reasons. And finally, it says, notice a drop of liquid or blood on your skin post your injection. So after you give yourself the injection, if you notice some blood on your skin, is that normal? That is normal. It says this occurrence is typical. Apply a cotton ball or gauze to the site without rubbing it. So just dab. I take a cotton ball and just kind of dab wherever that area is. It's just always good to be clean and disinfect an area before and after you take an injection. That's what I always do. Those are some of the frequently asked questions about injection sites, what should happen when you're injecting. If you've never injected before, I don't care how many times you watch a video or you hear someone explain how to do it, you even see someone doing it, you have to have the experience yourself, because in the middle of the experience, something can happen to you. You might think about the video that you saw, but it's not the same as actually working it out yourself and having an idea in your head of what you're supposed to do. Experience is the best teacher, as they always say. Good luck taking your injections. Refer back to this video if you need to. Leave a comment in the comment section if you have any tips you want to share. Thank you for watching. See you in the next video. Bye. Remember, slow and steady wins the race. Just don't quit.